Come in.
Hi, how are you doing?
Good, thank you.
My name is Guadalupe Rios, and I'm a family nurse practitioner student with the University of Texas at Arlington. I'll be taking care of you today.
Okay, thank you.
I see here your name is Mrs. Galvan.
Yes,
Is that right?
yes.
And do you always go by Mrs. Galvan?
You can call me Melinda.
Okay. Melinda, can you tell me your date of birth?
September 24, 81.
Okay. And I just wanted to start by saying that everything that we discuss today is going to be confidential, okay? So that means that I'm not going to discuss it with anybody else that's outside of the treatment team or that doesn't need to know that information.
Okay.
Do you have any questions about that?
No.
Okay.
No.
Let's start by washing my hands.
Okay.
And can you tell me, Melinda, what brings you into the clinic today?
Headache.
Oh, I'm sorry to hear that. Okay. And can you tell me, when did your headache start?
Yesterday.
Okay.
Yeah,
And what were you doing when you noticed it?
I was in front of my computer. I was working.
Okay. And is it constant, or would you say it comes and goes?
It comes and goes.
And can you point to where it hurts?
Around here, the temple area.
Okay. And does it stay here, or does it move?
It stays.
It stays
in that area.
Okay.
Yeah.
And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, what would you rate your pain right now?
Around a 3.
Okay. And how would you describe your pain?
Like sharp.
It's a sharp pain. Okay. And can you tell me, is there anything that you've noticed that makes your pain feel better?
When I sleep, and then when I take my Tylenol.
Okay. And what type of Tylenol do you
It's just the Tylenol. I brought the bottle, regular
Okay.
strength, 325.
325. Okay. And how many do you take?
Two a day.
2 a day. Okay. And so you take just one if you're feeling the headache?
Yes.
Okay.
Yeah.
And then does it make it go away, the pain, completely when you take the Tylenol?
It does. It does.
And then can you tell me, is there anything that you've noticed that makes your pain feel worse?
When I'm in front of the computer.
So every time you get the headache again? Okay.
Yeah.
Alrighty. Well, I'm hopeful that we can get that straightened out for you, okay?
Thank you.
So let's talk about medications. Are you on any type of scheduled medications or prescribed medications?
No.
Okay. Besides the Tylenol for your headaches, do you use Tylenol for anything else?
No.
Okay.
No.
What about herbal medications?
No, none of that.
Essential oils?
Mm-hmm.
Okay. Let's talk about allergies to medications. Any allergies to medications?
Not that I'm aware of.
Okay.
No.
What about seasonal allergies?
No.
Allergies to pets or mold?
Mm-hmm.
Okay. What about food allergies?
I'm lactose intolerant,
Okay.
so I just stay away from dairy.
Okay. And can you tell me what happens when you eat dairy?
I get loose bowel movements.
Okay. And you just avoid it altogether?
I
then?
do. It's
Okay.
better.
Okay. And can you tell me the date of your last menstrual period?
It was last month around the 14th.
Okay. And are you currently using any type of birth control?
No, currently not. My husband and I are trying to have a baby.
Oh, congratulations.
Thank you. Thanks.
How long have y'all been trying?
Around 4 months?
4 months. Okay. And have you ever been pregnant?
No.
Okay. Hopefully soon.
Yes.
All right. And I see here that you brought us a list of your immunizations
Yes,
currently.
I did, yes.
So I'm going to just review them with you, okay?
Okay.
MMR,
Yes.
tetanus,
I got that, yes.
okay, hepatitis A and B.
Yes.
Okay. I see here last year you had the flu shot.
I did, yeah.
What about this year?
No, I haven't had it this year, but I get it every year. So.
Every year. Perfect. That's fantastic. Okay, and can you tell me the date of your last physical exam?
It was last year, probably around February.
February. Okay, and did they do any blood work for you?
They did.
Okay,
Yes, but
and how did it
everything,
turn out?
yeah, everything came back normal.
Okay.
Everything
So
came back-
no follow-up required then on
Mhm.
that. Okay. What about any diagnostic testing?
No.
No ultrasounds, no X-rays,
No.
nothing like that. Okay. And right now, how would you rate, or what would you say? How would you describe your health?
It's excellent.
Okay. That's good to hear. What about, have you ever been treated for depression or any type of mental health issue?
No.
Okay. Measles or mumps
Oh, I had
when you
chickenpox.
were a child? Okay, chickenpox. Do you remember how old you were?
No, I don't. It's been a while. I mean, I was young.
Okay. In grade school?
Yes, grade school.
And what about when you were a child? Did you have asthma?
No.
Okay.
No.
And as an adult, any history of cancer,
No cancers.
high blood pressure, diabetes? No? What about asthma or emphysema as an adult?
No.
Any recent hospitalizations?
It was not very recent, but probably around 7 years ago, I had a colonoscopy.
Okay. And a colonoscopy at your age isn't typical, or 7 years ago.
Yeah.
Can you tell me what did they have you do it for? What
It was for IBS.
IBS. Okay. And what were the findings?
Everything was normal.
So no follow-up, no medications that they put you
No.
on? Okay. Any history of blood transfusion?
No.
Okay. And what about any car accidents or major injuries?
No, none of that.
All right. Would you consider yourself disabled?
No.
Okay. Any use of any type of assistive devices like a cane or a walker?
No.
Alrighty, and we're going to talk about your family history, okay?
Okay.
And when I'm asking you about your family history, we're talking about your parents, your siblings, and your grandparents on both sides.
Okay.
Any history of diabetes?
Yes, my sister has diabetes.
Okay.
Yes.
And do you know what age she was when she was
Around
diagnosed?
35.
35. Okay. What about heart attacks?
No history.
Okay. Cancer?
No.
Any thyroid issues?
Yes, my sister and my mom.
Okay. And your sister, what type of thyroid issues does she
She
have?
has hyperthyroidism,
Okay.
and my mom has hypo.
Okay. And how old was your sister when she was diagnosed?
She was around 25, and my mom, I would say, was around 20 years ago.
Okay. So opposites.
They are.
Righty. And do you or have you ever smoked
No.
e-cigarettes, tobacco products?
No.
No chewing tobacco? Okay. And what about alcohol use?
Every now and then, occasionally.
Okay. How many drinks would you say you have then?
I would say maybe 2 every now and then if we go out.
Okay, and that's 2 per hour or 2 the whole
two,
time?
to the whole night.
Okay.
Yeah.
What about illicit drug use?
No.
Okay. Have you ever used prescription drugs that weren't prescribed for you?
No.
Okay. What about chemical or electrical exposures, especially or when it comes to your work?
No.
Okay. And tell me, what type of hobbies do you have, or what do you do for fun?
I like to read and I like to work out.
Oh, okay. And how often do you work out?
Probably 5 times a week.
Wow, that's fantastic.
Yes.
Very active.
Yes. Have to be.
Yeah. And tell me, where do you live currently?
I live in Copper Hill.
Okay.
The city of Copper Hill.
Okay. And you live in a house or an apartment?
A house.
Okay. And who lives with you at your house?
It's my husband and my little dog. Or she's not little, she's big.
Oh, okay. What type of dog is it?
She's a German Shepherd mix, black lab.
Oh, okay. I love dogs.
So do I. She's our sweetheart.
All right. Have you ever been in the military?
No.
Okay. And we're going to go over just a review of different body systems, okay? It's going to be a bit lengthy, so you can just answer yes or no, and
Okay.
we'll just keep it moving right along, okay? Have you experienced or are you experiencing any fatigue or tiredness?
No.
What about any chills?
No chills. No.
Okay. And can you tell me your average weight?
142.
142. Okay, and I saw today you were 142,
Yes.
so that is normal for you, that weight. Okay. All right. Any skin issues, a rash?
No.
Okay. What about excessive sweating?
No. No issues with that.
Okay. What about any type of abnormal hair growth?
No.
Okay. Blurry vision?
No blurry vision.
Do you use eye drops at all for
No.
anything? Okay. What about any type of hearing issues?
No.
Concussion?
No history of concussion.
Any nosebleeds? What about sore throat or bleeding gums?
No.
Okay. Any pain or tenderness in your breast?
No.
Okay. Any pain or difficulty with breathing?
No.
Coffee?
No.
Wheezing? Okay. It's easy when it's all nose.
Yeah.
Alrighty. What about any pain in your legs when you're walking?
No.
Okay. Are you easy to bruise?
No.
Or do you have a history of clots or blood clots?
Mm-mm.
Okay. How would you describe your appetite?
Good.
Good?
Good.
Okay. Is there anything that you're restricted from eating?
Just the dairy.
That's right. Okay, dairy. Do you drink coffee?
Yes, every now and then.
Okay. How many cups a day would you say?
1 cup every few days.
Okay, so not every day.
No.
Okay. Any other caffeine intake?
No.
Cokes? Okay. Any pain when you go to the bathroom, when you urinate?
No.
Okay. What about any type of blood in your urine?
No.
Kidney stones?
No history of that.
Okay. What about constipation?
No.
Okay. And you talked about diarrhea when you drink or when you eat lactose, right? Any other times diarrhea?
No.
Okay. All right. What about, can you tell me the date of your last or the first time you had a menstrual period? How old were you?
I was around 12.
Okay. And are your periods regular?
They're regular.
Every month?
Every month, yeah.
Okay. And when was your last pap smear?
It was last year.
And you go every year?
Yes.
Okay. That's good. And what about joint stiffness?
No. Everything's fine.
Any type of bone deformities?
No.
What about, are you restricted from any kind of movement?
No.
We're almost done.
Okay.
I know it's a lot of questions.
Yeah.
What about a history of seizures?
No history of
Okay.
seizures.
Memory loss?
No, ma'am.
What about any type of paralysis or any spot on your body that you can't feel?
No.
Okay.
No.
Lymph node enlargement?
No.
Pain or tenderness specifically in the neck area?
No.
No? Okay. Anemia?
No. No history.
Bruising? Sickle cell?
Mm-mm.
No. Any type of blood cell disorders at all?
No.
Okay. What about any history? I know you mentioned that your family has thyroid issues that run through your Risa and your family. Any issues with you with your thyroid?
No.
Okay. What about unexplained weight loss or gain?
No. Everything's normal.
Any feelings of always being hot or always being cold?
No, ma'am.
Okay. And tell me, any mood changes recently?
No.
Okay. Feelings of anxiousness?
No.
What about difficulty concentrating?
No.
Okay. So we're all done with that portion.
Mm-hmm.
Any questions over anything we've gone over?
No, not at this time.
I'm sorry, I know that's pretty lengthy.
Mm-hmm.
So now what we're going to do is we're going to go ahead and get an overall assessment on you, okay?
Okay.
We'll go ahead and get started.
Okay, thank you.
Uh-huh.